if there's even a 1% chance to avoid surgery, I'm all in. We don't have to just offer surgery. We don't have to be known for, oh, that surgeon, if you go to that surgeon, they're only gonna cut. Modern orthopedics is getting this wrong. We treat platelet-rich plasma like a last resort, when it should be the first weapon we reach for. And we're ignoring the most powerful treatment in medicine, the patient's own biology. And that ends today. I'm Dr. Ariana DeMers, the Queen of Business Orthobiologics, and I am leading the way in orthopedic surgery innovation, shaping medical practices for success. I'm going to show you today why PRP should not be the last resort, but the first step before you ever think about surgery. Because the truth is this: most musculoskeletal injuries don't fail patients. We fail them when we skip the foundational healing step. In this video, you'll discover why PRP works, why technique matters, and how it can delay or even avoid the need for surgery altogether. Yes, I said it, the need for surgery altogether. So why should PRP be your first-line treatment before surgery? Let me tell you about a patient I'll call Mark. He came to me with a torn tendon for a surgical consult that was already scheduled with another physician. And he looked exhausted. He was physically exhausted, emotionally exhausted, financially exhausted. And he said, if there's even a 1% chance to avoid surgery, I'm all in. And I told him, there isn't a 1% chance. There's real opportunity here. He'd been through the cycle. You know the one. Anti-inflammatories, steroids, rest, PT, repeat. Nothing healed. And he was never offered PRP. Not even once. Here's what most people don't know. Your body has the tools to heal. The platelets, the growth factors. It's a natural repair blueprint. And PRP is simply a concentrated version of that blueprint, injected exactly into the tissue that needs the most help. So watching Mark's function return after PRP injection wasn't magic. It was biology. And weeks later, the surgery that he had scheduled, he canceled. And months later, he was doing all of his activities, and he almost forgot that he had to jump through all those hoops and that he was down at all. So let's start with this framework of how to think about it. When we think about treatments for our patients, and I'm sure we all are the same way, we want to start with the least invasive, but we also want to give them something that actually works. So as we know, surgery is pretty traumatic. It's trauma, right? And we hope that we repair that piece of the body, that structural deficit, and then we allow the body to do the rest of the healing. Now, PRP just supports the healing without adding additional injury. And so we do have to have good patient selection. It doesn't work for everybody. It's not magic. It doesn't make fully torn tendons jump back onto the bone or jump back together and mend themselves. So PRP works beautifully for early osteoarthritis, partial tendon tears, ligamentous partial injury, where the structure is, for the most part, present but damaged. And that's where we consider this to be a biologic deficit, where biology can help. And that's where we use PRP. So PRP by itself is not the only thing that needs to be attended to. We also know that technique matters. And so it's not just PRP. there are nuances that need to be considered. Dose, concentration, ultrasound guidance, these all dramatically improve outcomes for patients. And even if patients eventually need surgery, PRP can help to repair some of those tissues before heading into that structural reconstruction or repair. So PRP allows for patients to regain mobility. It gives doctors options that they didn't previously offer their patients. And our field regains integrity so that we can finally lead with what's best for the human body and not just because this is the way we've always done it or the system. And it allows us to give our patients all the options. We don't have to just offer surgery. We don't have to be known for, oh, that surgeon, if you go to that surgeon, they're only gonna cut. No, we can be known for being the doctor, the physician that helps patients heal, that helps patients get back to their activities by any means necessary, whether it's injection-based therapies or surgery or both. So when we stop doing surgery, because that's the only tool in our tool belt, we are able to start doing surgery only as necessary when that's truly the next best step. So here's what I want you to walk away with today. Most patients don't need to jump straight to surgery, and they sure as heck don't want to. And their biology deserves a chance to heal first. PRP is that chance. And when applied correctly, at the right dose, for the right patient, under guidance, it can change the trajectory of an injury. It can transform your patient's life. So remember, you're not just treating injuries. You're not just treating torn tendons. You're restoring possibility for your patients. If you believe in leading with biology and restoring the art of healing, please join my newsletter. I share tools, protocols, and strategies to help you practice medicine with more freedom and more integrity. And make sure you subscribe, because we are building a movement, a generation of physicians who choose orthobiologics, choose patient empowerment, and choose better medicine.